Part B, developed by Let's Update Language Academy. This audio is copyrighted. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Hey, I wanted to update you on Mr. Johnson, the patient diagnosed with COPD 2 weeks ago. His latest spirometry shows a decline in lung function, and he's been experiencing increased shortness of breath.
Got it, and the test result is concerning. Any changes in his medication or treatment plan?
Yes, the doctor adjusted his inhaler regimen, and we've started him on a pulmonary rehabilitation program due to severe shortness in breath. He's also using oxygen therapy as needed. Please monitor his oxygen saturation regularly. Though the deteriorating symptoms that we see day by day is challenging, but what intensifies the problem further is his non-receptive nature, but we need to reinforce proper inhaler technique during our education sessions. Also, he mentioned occasional chest pain, so we've scheduled a cardiology consult to rule out any cardiac issues. These all can be possible only with his cooperation.
Question 26. You hear the superintendent of a care home for the elderly talking to the nursing staff. Now read the question.
Good afternoon, everyone. I wanted to discuss the recent survey on elderly welfare in our care home. It's vital we address any areas of improvement. The survey highlighted some concerns about communication. Maybe we can work in our communication protocols in the future. Now current communication systems suffice. I noticed a positive response regarding activities. Residents seem to enjoy the current schedule, but perhaps we can enhance with more variety to keep things engaging. That would be great. Also, introducing regular social events and personalized interactions could make a difference. It's crucial to foster a sense of community and individual connection.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Good morning, team. I want to update you on Mrs. Anderson, who was admitted yesterday after a fall from stairs. She did mention dizziness before the fall, and I've scheduled a neurology consult to rule out any underlying issues initially. Then she's stable now and her scans were clear, so we canceled the plan. But keep an eye on her mobility. Physical therapy will work on a personalized plan from the therapist to prevent further incidents, which we have organized the same. Any concerns from the night shift?
Vitals have been stable and she rested well. I've ensured the bed alarms are active to prevent any accidental movements during the night.
Good job. Let's continue close observation. We'll also involve the social worker to assess her home environment for potential safety improvements. Keep me posted throughout the day and thank you for your diligence.
Question 28. You hear part of an orthopedic consultation at a GP practice. Now read the question.
Good afternoon, Mrs. Davis. I understand you've been experiencing some discomfort in your knee. Could you share more about when it started and any specific activities that aggravate it?
Hello, doctor. Yes, it began a few weeks ago, and it seems to hurt more when I climb stairs or walk for an extended period.
I see. Let's start with a physical examination of your knee. Any specific areas that feel tender, or have you noticed any swelling?
The pain is mostly on the inner side, and yes, there's a bit of swelling, especially after being on my feet for a while.
Thank you for sharing that. I'll check the range of motion and conduct a few tests. We might also consider an X-ray to get a clearer picture of what's going on. Let's proceed with the examination, and based on the findings, we'll discuss the next steps in managing and treating your knee pain. Sound good?
Yes, doctor. Thank you for looking into it.
Question 29. You hear a trainee doctor explaining his senior about a problem he had carrying out a procedure. Now read the question.
Dr. Smith, I wanted to talk to you about the lumbar puncture I attempted earlier. I encountered some challenges and I'm concerned about my technique.
Of course, I appreciate your honesty. Can you walk me through what happened and what difficulties you faced during the procedure?
Well, I struggled with the positioning of the patient, and despite multiple attempts, I couldn't get the needle in the right place. The patient was uncomfortable, and I decided to stop to avoid causing more distress. Now I lack confidence to do to anybody.
It's all right, these procedures can be challenging. Let's review the technique together, and I'll provide some tips. Additionally, we can schedule some practice sessions, and I'll be there to guide you through it. It's crucial to learn from these experiences.
Thank you, Dr. Smith. I'm eager to improve, and your guidance will be invaluable. I'll gradually gain the confidence. Question 30. You hear a doctor talking to a young woman who has irregular periods. Now read the question.
Hello, Emily. I understand you've been experiencing irregular periods. Can you share more details about your menstrual cycle and any patterns you've noticed?
Hi, doctor. Yes, my periods have been quite irregular for the past few months. Sometimes they're early, sometimes late, and the flow varies too.
I see. Have there been any significant changes in your life recently, like stress, changes in weight, or any new medications?
Well, I started a new job, so there's been a bit more stress. And I didn't lose any weight recently, unintentionally.
Thanks for sharing that. Stress and changes in weight can indeed impact menstrual cycles. I'll perform a physical examination and may recommend some blood tests to check hormonal levels. Additionally, we'll discuss your lifestyle to identify potential contributors. Let's also investigate this further to determine the underlying cause. In the meantime, make sure to maintain a healthy lifestyle, manage stress, and we'll work on finding a solution to regulate your menstrual cycle.
Yes, doctor. Thank you for looking into it.
That is the end of Part B.